Rynex Pe is a combination medication that is used to temporarily relieve symptoms caused by the common cold, flu, allergies, or other breathing illnesses. Antihistamines help relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing, while decongestants help to relieve stuffy nose and ear congestion symptoms. If you are self-treating with this medication, it is important to carefully read the package instructions to ensure it is right for you before you start using it. It is also important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years. Therefore, do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by a doctor. Additionally, some products are not recommended for use in children younger than 12 years, so it is important to ask your doctor or pharmacist for more details about using the product safely. It is also important to note that these products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, it is important to carefully follow all dosage directions and not give other cough and cold medication that might contain the same or similar ingredients. It is best to consult with a doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking Rynex Pe, always follow your doctor's instructions. If you're self-treating, make sure to read and follow all the directions on the product package. If you have any questions, don't hesitate to ask your doctor or pharmacist. You can take Rynex Pe with food if it upsets your stomach. Make sure to drink plenty of fluids, unless your doctor advises otherwise. If you're using the liquid form, be sure to measure the dose carefully with a special measuring device or spoon. Don't use a regular household spoon, as it may not give you the correct dose. If the liquid is a suspension, shake the bottle well before each dose. Do not crush or chew extended-release tablets or capsules. If you're using chewable tablets, be sure to chew them thoroughly before swallowing. The dosage will depend on the product you're using, your age, medical condition, and how you respond to the treatment. Don't increase your dose or take it more often than directed without your doctor's approval. Taking it improperly may lead to serious harm. If your doctor tells you to take Rynex Pe daily, make sure to take it at the same time every day to get the most benefit from it. And remember, if your symptoms last for more than 1 week, get worse, or if they occur with a headache that doesn't go away, fever, or rash, make sure to consult with your doctor. These could be signs of a serious medical problem. Some common side effects of Rynex Pe may include drowsiness, dizziness, dry mouth, headache, upset stomach, constipation, or trouble sleeping. If any of these effects persist or worsen, notify your doctor or pharmacist. If your doctor has prescribed this product for you, it means they have determined that the benefits outweigh the potential risks of side effects. Many people using this product do not experience serious side effects. However, you should seek medical attention if you experience any serious side effects, such as mental/mood changes, ringing in the ears, difficulty urinating, or vision changes. Seek immediate medical help if you experience very serious side effects like fast/irregular heartbeat or seizures. While a severe allergic reaction to this drug is rare, seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, consult your doctor or pharmacist. As for the best time to take this medication, follow your doctor's instructions for the appropriate daily dosage. Before taking Rynex Pe, make sure to inform your doctor or pharmacist about any allergies you have or if you have any medical conditions. This medication may contain inactive ingredients that can cause allergic reactions or other problems. If you have a history of breathing problems, diabetes, glaucoma, heart problems, high blood pressure, kidney or liver disease, seizures, stomach or intestinal problems, overactive thyroid, or difficulty urinating, it's important to let your doctor or pharmacist know before using Rynex Pe. Rynex Pe may cause drowsiness or dizziness, so it's important to avoid driving or using machinery until you know how it affects you. If you consume alcohol or marijuana, it may increase these effects. It's also important to limit alcohol consumption and discuss marijuana use with your doctor. For those with diabetes, alcohol dependency, liver disease, or phenylketonuria, PKU, it's important to be cautious when using Rynex Pe, as certain forms of this medication may contain sugar, alcohol, or aspartame. Always consult with your doctor or pharmacist before using this product. Before undergoing surgery, it's important to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that children may be more sensitive to the side effects of Rynex Pe, especially excitability and agitation. Older adults may also be more sensitive to the side effects, such as dizziness, drowsiness, confusion, constipation, fast or irregular heartbeat, trouble sleeping, or urination problems, which can increase the risk of falling. If you are pregnant, Rynex Pe should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. If you are breastfeeding, it's important to consult your doctor before using Rynex Pe, as it may pass into breast milk and the effect on a nursing infant is unknown. It's important to be aware of any potential drug interactions with Rynex Pe. Talk to your doctor about all the medications and herbal products you are currently using, and make sure to mention Rynex Pe when discussing any new prescriptions. Some products that may interact with Rynex Pe include antihistamines applied to the skin, such as diphenhydramine cream or ointment. Avoid taking MAO inhibitors during treatment with Rynex Pe, as this may cause a serious and possibly fatal drug interaction. Make sure to ask your doctor when it is safe to start or stop taking this medication. Be cautious if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. Check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. It's also important to note that Rynex Pe may interfere with certain medical and lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using this medication. If someone has taken too much Rynex Pe and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the local poison control center at 1-800-222-1222. In Canada, contact a provincial poison control center. Symptoms of overdose may include irregular heartbeat, hallucinations, fainting, and seizures. Always seek medical help if you suspect an overdose. It's important to follow your doctor's instructions when taking Rynex Pe. Do not share this medication with others. Make sure to attend all medical and lab appointments as directed by your healthcare provider. If you are taking Rynex Pe on a regular schedule and happen to miss a dose, take it as soon as you remember. However, if it is close to the time for your next dose, it's best to just skip the missed dose and take the next one at your regular time. It's important not to double the dose to make up for the missed one. Always stick to the recommended dosage and timing for the best results. When it comes to storing Rynex Pe, it's important to keep it at room temperature and away from light and moisture. Make sure not to store it in the bathroom or freeze liquid forms of the medication. And, as always, keep all medications out of reach of children and pets. When it comes to getting rid of Rynex Pe, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. Remember, it's important to handle medications responsibly and safely. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.